I'm Chris Kelly from the Schoolcraft College Foundation. I'm the Director of Major and Planned Giving. And it's my pleasure to open the conversations today with two ladies that I heard give a very similar presentation earlier this year on a topic that is pretty crucial to all of us right now. So to give them more time to share with you, I'm going to turn this over to Kara Gavin and allow her to make introductions and to get us started. Kara?
Thank you so much, Chris, and welcome everyone. And thank you for organizing this and for the invitation. I am Kara Gavin. I work for Michigan Medicine, which is the University of Michigan's medical center, and I'm a science writer there. And I have, over the years, been privileged to get to know Emily Summers, who's a PhD trained epidemiologist and specialist in understanding how diseases spread and how they act in society. And we were invited to give the talk to the Plymouth Rotary, but then invited to do this presentation. And we're really interested in helping the public understand this just incredible moment that we're in as a society, where we have a disease that has killed so many, sickened so many more, and a vaccine or several vaccines that are poised to help us reverse this. So we're going to go into both the pandemic itself, but also the vaccines. And I'm going to let Dr. Summers do most of the talking, but I'll be putting links in chat so that you can get more information on things that she's talking about. We collaborated on the slides, and I hope that you'll take away from today not only information that can help you as you navigate, but also information you can share with others. And I understand we're going to be having a recording, but I didn't know if that recording had started yet. So if we need to start that, that would be great, and then we can get going. And Dr. Summers, do you want to go ahead and start sharing the slides? And we'll begin.
The
recording has started. Fabulous. Thank you so much. So welcome, everyone.
Hi, everyone. I'm just trying to get my slide to share. Just one moment.
Let me know if you need me to jump in.
Yeah, I think, let's see here.
There you go.
Okay, it shows the,
yes.
Okay,
set.
and is it in presentation mode right now?
Not yet.
Okay.
There we
go. That look good? Okay. Hi, so thank you, everyone. It's a pleasure to be here. And as Kara mentioned, we have been working both for several months, almost a year now, on things related to COVID, both on the research end, communicating information. And we're really at a point where we have so much information that we've gathered over the past year, and actionable information, that we just want to make sure that we get the messages out that are based in evidence. There's a lot of misinformation out there. So we have a summary of what we think are relevant points that are important for the community, and we'll leave time for plenty of questions. And if there are questions that arise afterwards, you would be able to access, get those forwarded to us by email if you have any remaining questions. So I'm an epidemiologist. My day job normally would have been working on autoimmune diseases, including lupus. But like so many people back in around March, my career drastically took a leap in a different direction, back to infectious disease epidemiology. And the public health workforce really has always been stretched a little bit thin, but the onset of this pandemic really required those of us from a variety of fields to jump in and really apply our skills towards this common problem. So I'll just start with a brief review of the terminology, so we're all at a common starting point. So the name of the virus is a severe acute respiratory syndrome coronavirus 2, and this is what you can call SARS-CoV-2. And it's when we use the term COVID-19, we use it kind of loosely to talk about everything pandemic related, but technically speaking, that's really the designation for the term that relates to when you have clinical symptoms. So you can see the cartoon on the right, once you have a fever or cough, or maybe breathing pretty fast, that's when you can call it coronavirus disease 2019 or COVID-19. In the past year, as we all know, this new coronavirus has spread across the world. Over 28 million Americans have tested positive, many more are likely infected. We might be only catching 10% or so of cases. 500,000 Americans have died as of this week. And I have to say, every time I do a presentation or paper, it's so depressing to see this number creep up and have to be revised upward every single time. So hopefully we're at a point in the pandemic where we really can start to put the brakes on this. So more than 536,000 Americans have died than expected. And that probably reflects some of the side effects, so to speak, of things that might lead people to have less access to care, for instance, or overwhelmed hospitals, all these other side effects of the pandemic that are not directly related to the virus. Almost 2.5 million people worldwide have died of COVID-19. And the US makes up a disproportionate share. 1 in 5 of these people are from the US. So it's not all bad news right now. You can see these graphs of weekly trends from the beginning of the pandemic, starting in March in the US and up until just about, last week. So we have weekly tests, weekly cases, the number of people hospitalized, and the weekly deaths. And on the very right-hand side of each of these curves, you can see a pretty dramatic decline in the slope, which is really good news. And so this is coming post-holidays, and we don't know all of the reasons for this decline at the moment. Of course, it's happy news. We think there might be a small effect of vaccinations already trickling into these numbers, although there always is a lag with these sorts of things. There's perhaps a seasonal component, again, the tail end of the holidays. So there's a combination of factors that we think are helping lead us to this good news of downward trends in each of these metrics. Now, the important thing is for us right now to all double down on every mitigation strategy that we have at our fingertips and not to get lazy. We're all very fatigued of the pandemic, but this is not the time to relax any of our measures. And I always like to make sure we acknowledge the effects of COVID that are really, really significant outside of mortality. So this pictorial shows that for every one person that dies of COVID-19, represented by the red square in the upper right-hand corner, 42, represented by the yellow squares, experience symptoms 60 plus days later. 34 suffer from lung dysfunction. We've seen lung scans that look terrible even in people that did not have many symptoms. So this is something that we don't really understand the full implications of, other than there can be damage happening even in those that only display mild or even no symptoms. 29 exhibit inflammatory heart disease. So you may have heard some reports in sports, for instance, of sudden death. There's been a couple of cases of persons who have a lot of exertional exercise and had maybe a very mild or asymptomatic case of COVID, but yet they developed some heart inflammation, and that put them at risk because it wasn't fully healed. 12 folks who are represented by the orange squares are significantly financially burdened, and 2 are unable to return to work. So just to keep in mind that when we see these statistics, particularly the death statistics, that's just the tip of the iceberg. So in the past year, scientists, public health experts, and clinicians worldwide have cooperated in a really fabulous manner to discover all kinds of things in record time. The genetic makeup and action of the virus, how it spreads, what can stop it or slow it, treatment for all stages of illness. We're really making strides there, and who is most at risk and why. We have also in the past year seen supply chain vulnerabilities that have been revealed. Pharmaceutical firms have developed and tested vaccines and treatments, again, at an unprecedented rate. This is really a miracle of science that we're experiencing. And part of this was also the fact that the governments have made investments that really made this happen. So they prepaid for vaccines, for instance. So when this has occurred, that reduces the risk of the pharmaceutical firms and just increases their ability to really make this rapid progress that they might not have been as successful in doing had they not had the benefit of the investments of governments worldwide. The politics have unfortunately altered our public health responses and created variations by state. So this is a really unfortunate thing that has been exposed in the pandemic, is that the politics have really driven a lot of features, and we probably don't need to belabor this point. But again, we really strive on the public health end to get clear information out there, evidence-based information. It is a struggle because so much is new. We're constantly learning new things and having to revise our understanding. So sometimes when the public health message changes, it's because we've learned more, and we need to, as a society, understand that's what is happening. And it's not necessarily that, there was a concerted attempt to provide misinformation previously. And behaviors have fueled uncontrolled spread in many ways, everything from political rallies towards just careless behaviors. Again, everyone is fatigued. This is not a blame game, but just understanding basically that we all have a role to play in our personal responsibilities, and that we absolutely each have a role that we can play in breaking chains of transmission. And we've also seen some dramatically uneven effects on some groups and health disparities. So where are we now? In Michigan, we're doing better than most states. And that's because of many statewide efforts that have successfully driven down our rates and helped to control outbreaks. Many schools are back to in-person learning. And again, this is being done in a very careful and measured way in most cases. Lots of risk mitigation strategies that we have learned have worked in these settings and in these controlled environments. So that's really good news. Vaccination is underway. 2 vaccines, as you, I'm sure, are aware of, are already approved for emergency use in the US. And the FDA is reviewing this week data from Johnson & Johnson. So as early as Saturday, we might have a 3rd vaccine that is available to us in the US. And there are new federal prevention and vaccination plans. Again, the shift in government has made a lot of changes happen. The thing that probably most delighted about is the more active role that the CDC is playing. So I think that's another crucial thing that has really been important. In the past couple of months, we've seen them be able to take on a more active role and really re-review lots and lots of evidence, and more guidance is coming out from the CDC. And that's just great news for all of us. 3 months in Michigan into the pause to save lives. So as you probably recall, if you're from Michigan, on November 15th, there was a pause that was announced. At the time, Michigan had the 6th highest rate of cases among the US states and territories. So you can see on the left-hand arrow here on the bottom of the screen, that's where we were in terms of incidents when the pause was announced. At that time, so these horizontal lines, I'm not sure if you can see my pointer, but the horizontal lines on the graph represent risk threshold levels. And where this says 150 cases per million per day, that represents what we call the highest level of risk. And in November, we were 6-fold higher than that. So all along since November and since the pause was called, we've seen a pretty steady decrease, which is wonderful news. And we've gone down now statewide a couple of levels for the most part, which is great news. I just want to keep in mind that this is still high levels of disease. So we still have a lot of community transmission, but we're in the right direction. So again, we don't want to loosen up our guard, but I just want to use this as an incentive to show the community that what you do matters. Another way to look at the data, this is graphed to show this vertical line on the graph is when the pause was called. You can see Michigan in the light blue turquoise color started off pretty comparable to some other Midwest states. We have Indiana and Ohio, our neighboring states, graphed here as well. And after the pause, the effects of the intervention, we always see a lag after these interventions. We expect at least a 2-week lag before we see the effects take place, but we've seen a really nice decrease. And in comparison to other states that did not have a similar policy taking place, you can see that Michigan is considerably lower. So this is a really big deal in terms of what we've been able to do in our state. From the School of Public Health at U of M, models have estimated from Dr. Marissa Eisenberg's group that we've prevented at least 100,000 cases of COVID in Michigan. And to look at Western Wayne County, where I think most of the audience is located, the incidence, for the most part, mirrors a lot of the rest of the state. Here's a zoomed in view starting in January. We did have a weird peak in January that you can see But again, we've seen this steady decline that is really favorable. And we've, this data right here is graphed on a dashboard that my research group has made. I have a couple of students from the School of Public Health that work on this and update it twice a week. Kara or one of us can, the link is down below, but we can share that link if you don't have a chance to grab it. But this is something that everyone in the community can access, and we have information for all of the municipalities in Wayne County, meaning outside of Detroit. The Detroit City Health Department has separate data, and so that's why we don't include Detroit in the Western Wayne County data, in the Wayne County data. And the just going back again towards November to expand our time frame here in Western Wayne County, you can see this arrow where the pause took place. Despite the two weird peaks that we see in December and January, again, the trend has been decreasing for our local communities, much like the rest of the state. So testing is now widely available. Who should get tested? People who have had close contact with someone who has tested positive. If you've taken part in a high-risk activity, and some of these, as determined by the CDC, would include travel, attending large social or mass gatherings, or being in crowded indoor settings. And there still is a recommendation to try to limit non-essential travel, especially if it requires taking public transportation or things like flying, which includes multiple points of transit. You know, it's not just the flight itself, there's multiple points of transit. So we're still at a stage where we're trying to keep travel to essential activities. And that also can reduce the speed at which the variants that you've probably heard about can be spreading into different communities. Other people who should get tested would be if you have COVID-19 symptoms or if you have been notified by the health department. And again, if you do see a phone call coming through from a health department, please answer that call. You know, the contact tracing that is done is one of the things in our arsenal that can help control outbreaks. And we just have here a snapshot of one of the testing sites that has been implemented in Canton since January, just to show again that testing has expanded and is more accessible. Most of the testing is free of charge. Your insurance might get charged. It's usually only rapid tests, which are elective, that you might see a charge for, but by and large, we don't want diagnostic testing to be, we don't want financial issues to be a barrier for anybody. So you should be able to expect free testing. So things that are not so good are that vaccine supplies to states are very uneven, as well as within states. These shortages of vaccine can feed frustration. I'm sure you've heard many stories, you know, especially, you know, I've seen it with my own parents who are out of state trying to get access to vaccines that they're eligible for. It's a really tough environment, but you know, it's something that we just all have to live through and do the best that we can. There have also been scams that have been reported. Vaccine myths abound, which feeds hesitancy that could slow vaccination. And the new variants that are emerging, there are some that are concerning, and those can also feed the rate of transmission. What else do we know right now? COVID-19 absolutely is far worse than the flu. There really is no debate about this in the scientific community, despite what you may hear in the lay setting. We know that airborne transmission can occur. You might also hear this referred to as aerosol-based transmission. The main point is that this occurs especially indoor settings and that ventilation matters. It also means that if you're beyond 6 feet, which is the typical definition for close contacts, you still can be exposed in an indoor setting with recirculating air. The risk of illness and death rises with age, and some conditions, including obesity, raise the risk of severe illness. And the long-term COVID effects can be very real. Also, we know that now that you can get COVID twice. So that means you can be reinfected. This is not necessarily extremely common, but these situations do occur. And especially now that we do have additional variants circulating that can especially reduce the protective immunity you might have from a first infection. Something interesting we have also learned is that there may be differences in symptoms across demographic groups. So the classic symptoms, which we often hear about, which are cough, fever, and shortness of breath, more often occur in men and in the age group of 30 to 60. Whereas in women, they are more likely to have confusion, digestive symptoms, headaches, and chest pain. As well, in older and younger groups, we might see more of the non-respiratory symptoms. These in kids could include digestive issues, pain and sore throat, and in older adults, confusion. So this is important to increase our vigilance if somebody that you know or yourself are experiencing symptoms, even though they may not be the classic symptoms of cough, fever, and shortness of breath. We do want to pay attention to some of these what we could refer to as atypical, but we like to call non-classic symptoms. We know now for sure that masks keep the virus both from getting in and getting out. So they protect the person wearing the mask as well as persons around you. Mask quality and effectiveness varies. I'll talk a little bit more about masks in a few slides. The fit matters. A second mask can be worn to fill gaps. That may help in some situations. The more virus that you're exposed to, the higher your risk of illness. So this means not just about getting infected, but we believe that if you have a lower viral load, you might be able to fight it off to some extent, but still experience lower symptoms. So in other words, in some scenarios, a mask might not completely protect you from getting an infection, but it may protect you from more severe types of illness by keeping the viral load lower. Both kids and adults can spread the virus. So I'll just repeat that one more time. Kids can also spread the virus. We didn't know a lot about the virus early on. So because kids tend to be more likely to be asymptomatic or not develop symptoms, they're more likely to be silent carriers. And that's part of the reason why we didn't understand the role that they play in transmission, but it does happen. And half of the cases we believe of transmission do come from silent spread. So I'm just putting this up. I wish I could show you the video, but this is online. I saw a video recently of Boris Johnson. And if you look very carefully, these are two still grabs that Kara was able to make from the video. If you look very carefully at his hairline, on the left-hand picture compared to the right, there's a little, and again, I don't think my cursor, is my arrow showing?
Yes.
Oh, it is showing. Okay, so over here on the right, you can see, if you'd seen the video, as he's talking, there's air coming up the top of his mask, and it's actually, you can see his hair moving in the breeze. So that's an example of poor mask fit, even by one of our leaders that, hopefully is modeling proper mask use. So he's trying, but it's not what I would endorse as a high quality mask or proper mask fit. And that really, really, really matters. Along the lines of when you see a mask slipping down below somebody's nose, we actually think there's more receptors that the virus can latch onto in the nose as compared to the mouth. So on the same point, not just mask fit matters. What really drives me crazy is when I see people wearing a mask over their mouth only and not their nose, because that's really, really not accomplishing much. So here's a nice infographic from the state of Michigan. They've updated this recently. So this is a slightly newer version than one I've showed in the past. I'll walk through some of these, and these are things that everybody can be aware of and everybody can do. So I think it's really worth dwelling on these points. Okay, so first off, masks that are recommended are those that fit properly. That means snugly around the nose and chin with no large gaps around the sides of the face. Masks made from tightly woven fabrics. So these are fabrics that do not let light pass through when held up to a light source. I've even heard some people recommend that you can do a sniff test of sorts, where if you take a spice that is fragrant and hold it up, the more you can smell the spice, the worse the mask is. Masks with 2 or 3 layers are preferable. Another alternative is to wear a single mask, like a cloth mask, over a medical mask. And that gives you an extra layer of protection. I don't 100% recommend this across the board, because I think that can also introduce some problems with people fiddling with their mask, and it doesn't always work for everybody. So if you feel it's good for you, that's great, but it's not for everybody. Masks with inner pockets that allow you to put a filter in are a nice option. Non-medical masks that are disposable, that look essentially like surgical masks, are a good option. And those, of course, that have breathable fabric, you have to be able to breathe properly, and you don't want to be taking the mask off if you can't feel like you're breathing properly. So I'm going to get back to this point highlighted about the knotted and tucked properly tight fit. But options, as is pointed out, to improve fit include a nose wire or a mask fitter or brace, which I'll talk about in a moment. Okay, so what's not recommended? We do not recommend things like bandanas or neck gaiters, both because of the fit and those materials in general are not as suitable. So, and also again, if there are large gaps and they don't fit properly, that's a no-no. Masks with one layer, we do not believe offer adequate protection. Same with masks that are made from loosely woven fabric or that are knitted. I've even seen crocheted masks, which have visible holes in them, and that's no good. Another thing that people may not be aware of, you don't want masks with exhalation valves or vents. So you might think, well, why do they market these if they're no good? These are for other situations. These are for situations to protect the person wearing the mask, but they don't protect the people around you because you're still able to expel. So in the case of COVID transmission, we do not want any masks with an exhalation valve. Okay, we of course don't want masks that are hard to breathe through again. And one of the new updates that's particular for the northern climates is wearing a scarf or ski mask does not sufficiently count as a face mask for COVID transmission. So I'm going to pick on Boris again. You can see here he's touching his mask. So this is another thing, aside from the things that we've covered, please be sure that you're only handling the mask by the ear loops, cords, or head straps. Again, all the time I see people, even politicians, doing press releases, or they're up at a podium speaking to people wearing the mask, and then they grab the mask or they take it off of the loops, but then have it in their hand and put it in their pocket. Please don't do that. Try to wash your hands or use hand sanitizer before and after masking. We also recommend, if you're in a situation where you do need to take off the mask temporarily, either use something like a lanyard so you can just have the mask hanging without really touching it, or if you use a paper bag that is labeled with your name so you don't mix it up with anybody else, fold the mask in half so the inside of the mask is folded inward, and gently drop it into a paper bag for reuse. Okay, additional mask options. I'll just point out here in this country, for outside of the medical field, if you're just in a community setting, you might want to try a KN95 mask or a KF94 mask. These essentially are modeled after N95 masks, but the top version is the Chinese version and the bottom one is from Korea, South Korea. So what this means is that if they are not counterfeit, they should work pretty darn well. However, they're not regulated for use in medical settings, but they're really nice options for in the community setting. Some health departments have KN95s that you can access. So if you can't find them, I will say, these days you can find these on Amazon and lots of other places. Just try to stick with making purchases from a reputable vendor. And again, you might want to try a few different brands because the fit might vary slightly. Okay, nose wires are pretty self-evident. It's a nice option. Just make sure you really mold it around your nose to avoid what Boris was experiencing. Mask fitters and braces, here's a picture. These are from the CDC website. But this is something, again, if you Google, you can find these. Not everyone's familiar, but it's like a little device that you can put around a mask to help tighten it up. And that's sometimes a better option than double masking for improving fit. And I'll just put down here, the CDC talks about knotting and tucking as a way to make the surgical masks fit better. They have a video on their website that shows how to do this. It's a little bit complicated. So, I've heard people say it's good for Boy Scouts, but not all of us have the talent to do this well. So it's a personal preference, but it's worth checking out. All right, so that's my mask talk. I'll just review briefly about the incubation and infectious periods because this can help inform your thinking around how to prevent transmission and just improve general understanding. So what we know now is that the virus SARS-CoV-2, once you're exposed to a sufficient viral load to become infected, you have what's called an incubation period. And that incubation period can last from anywhere from 2 to 14 days. The median we previously thought was about 5 days long. Right now, we're thinking that, with variants, this might be slightly different, but by and large, we're thinking 5 days is about the right way to think about this. So that's after exposure, how long it takes for you to become, or going to be, if you will become symptomatic. Now, some people never become symptomatic, or some people have this before you have symptoms. We expect that you have about 2 days of this is that silent spread risk. So in general, if we're going to make try to make some assumptions here, the greatest risk of asymptomatic transmission we think is about 3 days after you've been exposed to the virus. Again, this can vary from individual to individual, depending on lots of factors, including your own health status, your age, all kinds of things. So these are generalizations. Okay, if somebody does develop symptoms, we think that for mild disease, a symptomatic period is generally about 12 days. And we consider the infectious period overall to be 12 days. And that's what quarantine and isolation periods are based on. Something that we like to also get the message out about is that for risk mitigation, there are several layers and lots of different strategies to lower our risk of transmission. And this Swiss cheese model has become popular and has evolved in the setting of COVID over the last several months. So this particular graphic is one of my favorites. This virologist from Australia who created this cartoon is really talented at science communication, and he had a much scaled back version earlier on, and it's been updated. There are also versions in other languages that we could send a link to if you have settings that you want to get the word out to other communities that where English is not their main language. But the point here is that, as with Swiss cheese, every layer of protection will have some holes. Every layer is imperfect, and that's what the virus takes advantage of. So as far as personal responsibilities, the things that we can each do are physical distancing or staying home if we're sick, wearing masks, hand hygiene and cough etiquette, avoid touching your face. I always enforce not touching the eyes as one of the things to be very careful of, because the eyes also have receptors for the virus. And that's a route of transmission for many respiratory viruses. And if it's crowded, limit your time. That includes things like if you're going to a grocery store or other setting, don't dwell there if you don't need to, and try to limit the number of people in your household that are going to these different locations. We just want to minimize the number of interactions between people and households. So each of these layers, if you stack them up together, even if you physically distance, you still are getting exposed to a virus, a mask will give you extra protection, and you get the idea that hopefully the holes don't line up, but they will at some point. Now, shared responsibilities in a community include fast and sensitive testing and tracing, ventilation, being outdoors as much as possible, or promoting outdoor activities, air filtration and ventilation, government messaging and financial support, quarantining and isolation policies. So this isn't just doing these things, but from the government's point of view and the community point of view, supporting people who are required to quarantine or isolate, helping them financially or with food deliveries, things like that. We need to support people who are in these situations. And of course, vaccines. So one of my favorite modifications to this graph was the addition of misinformation mouse here, because every bit of misinformation really erodes our understanding and just makes the holes wider. So that's the main point. I don't want anyone to feel.
Oh, Emily, your audio went out.
Okay, I don't know what happened. Sorry. Yeah, so the point is no measure is perfect, no individual is perfect. So we just have to do everything that we can, and all of these things add up. Hang on, my slide is not advanced. Okay, here we go. All right, so what else don't we know? If a person has been fully vaccinated, can they still be a silent spreader? We still are learning information and long-term follow-up in the community of people who have been vaccinated. So for now, the advice is if you have been vaccinated, we know that you're protected against becoming sick and having clinical illness. We do not know the extent to which you are protected against having a low-grade infection, which could then be transmitted to other people. So still we have to support mask use and other risk mitigation strategies, even if you've been vaccinated. And in the coming months, we'll learn more and more and understand how and when we can relax those requirements. How best can we treat people who are at high risk early in the course of their illness? Again, we're making strides in medications, but we still have a lot of mileage to cover and to really improve our arsenal of medications. What makes some children and healthy adults vulnerable to severe illness? So these would be people who you wouldn't expect have the underlying health profile or age profile that would put them in the hospital, but it still happens and we don't always know why. And how best to treat the long COVID effects. We're going to be seeing the effects in the community for a long time to come of persons suffering from these long-term outcomes. There are clinics now at various health systems set up to learn how to best care for these people. But again, their suffering may be invisible, but it's very significant to those who are affected. And please, if you have anybody in your life experiencing these symptoms, know that this is real. And what is the full impact of the SARS-CoV-2 variants? We will be learning about this, but it's like an arms race. Every time we learn something, then the virus changes again. So we just constantly have to keep our guard up and learn as much as we can. Moving on to vaccines. So the first vaccines that have been approved in the US for use have been what are based on the mRNA technology. So this is a new type of vaccine platform that for the first time has been used. It's extremely exciting. You know, one of the best medical breakthroughs and, you know, scientific advances in our modern history. So it's really, really exciting. And Moderna and Pfizer are the two vaccines out now based on this technology. These vaccines are extremely effective, around 95% efficacious based on our clinical trials data. We're still learning more about the exact amount of effectiveness in the community based on the real world scenarios and long term. So we don't completely know how long vaccination status, how long the protection lasts. As with other vaccines, we may need booster shots in the future. So these are things that are very manageable and we will be able to handle, and the scientific community is absolutely at the ready to make sure that these issues are studied and addressed as appropriate. Now there's dozens more vaccines in development. I mentioned at the beginning of the talk that the FDA this week is reviewing Johnson & Johnson data. Now this will be exciting. The Johnson & Johnson vaccine is based on a 1-dose option. So this will be, and in addition, it does not have as stringent requirements for freezing and at the very low temperatures as the other vaccines. So this will be much more feasible to implement in many settings. And once we have access to it, we feel like it will be able to be deployed, whether it's in remote settings or, you know, places that don't have a lot of access to the technology that we might in more urban settings, and also across the globe. We have to be conscious that vaccination across the globe is essential. So of course, we're concerned about what's happening in the US and our local communities. And we want to support everything we can do in this country, but don't forget, until the full globe is adequately vaccinated, we'll still have risk of virus coming in from travel, including the propensity for variants to take hold. So I just want to get that message across too, is try to be patient. We definitely don't, in the long run, want to be the only country getting first access to the vaccine. Anyway, so hopefully by early as next week, we might see progress in being able to get doses of Johnson & Johnson in the US. Oh, and just one last point. So that Johnson & Johnson vaccine design is based on a tried and true scenario, a strategy that we've used in other vaccines. So just another different mechanism of action, which is really nice. So we're diversifying our portfolio of vaccines, and each of them has their advantages and disadvantages. My colleague, Dr. Jonathan Golub at the University of Michigan, made this nice graphic. We call this a heat map. This is just displaying side effects of the vaccines. So these are known side effects. They're not anything to worry about, but you should be aware of them because we don't want this to feed misinformation. We do think that the majority of people receiving these vaccines will have side effects. They'll probably last a day. It's a pain, but it's way better than getting the virus. So the darker the colors represent, the higher the percentage of people that receive the vaccine that will develop that side effect. So the majority of people will have significant pain at the injection site, again, probably less than 24 hours. Significant fatigue happens in over half the people. Headaches can be a significant symptom, as well as muscle pain. And these other symptoms are less frequent, but still they happen: chills, joint pain, fever, swelling, and redness. So again, this I'm mentioning not to scare anybody, but just so you're managing your expectations, and it's perfectly normal. In fact, it's almost a good sign because it shows that your immune system is getting a workout and prepared when it encounters the virus to do what it needs to do. And if you want to compare to other types of vaccines, the side effect profile is not too different from something like the shingles vaccine, which we have here on the left, and a little bit higher than the high dose flu vaccine. So again, this happens. It's a sign that your immune system's working. For vaccine rollout, I think I'll turn this over to Kara because she's been immersed in this area. So, so take it from here.
This is the most up-to-date graph from the
I'm not hearing Kara.
I accidentally remuted myself. Sorry about that. Okay, so this is the state of Michigan's most recent graphic showing the phases that they're going to roll out vaccination for. Every state is doing this differently. That is something that's a feature or a bug of the way the vaccine is being rolled out nationwide is individual states and even down to the county and large city area. You're going to see variation in who exactly is eligible when. And of course, vaccination is going to depend on the supply coming to that jurisdiction, that county, that city, that state. So that's why you might see that Macomb County is allowing people over 60 now, but Wayne County is still sticking to 65. And teachers in Washtenaw County are just now getting vaccinated, but teachers in Wayne County have been getting vaccinated for several weeks now. So there is variation and it's frustrating, we know that. So, but in general, what they're trying to do is use the CDC's guidance overall based on the risk of exposure and the risk of severe disease if someone does get sick. And we know that we have people who, it takes a while for these vaccines to start to really kick in and ramp up. And I posted in the chat a link to an article that my colleague wrote about actually what happens in your body from the moment of vaccine through days later and how it takes a while for these to start taking effect and really protecting you. So let's go to the next slide. And if you could advance them for me only. Sorry. So basically what you'll see is that right now, people who are in frontline jobs, teachers, first responders, a lot of them are getting vaccinated, including at Schoolcraft, right near where Chris is sitting right now, that are being put together by public health departments, where they're saying, let's focus on these frontline workers and do things where we communicate directly with their employer or communicate broadly and say, if you work in these jobs, come on to these clinics and you'll get vaccinated. So healthcare workers have by and large gotten vaccinated through their employers. And a lot of that was achieved starting in December through late January. But now we're getting into this area of other frontliners. Next slide. And actually that picture is one of our first vaccinees at Michigan Medicine. So now we're in this realm in Michigan where over 60 or over 65, depending on what county you're in, now those folks are eligible. But we've hit a major supply issue where we have incredible demand, which is wonderful, for vaccine, but not enough vaccine coming to the state. And so when we first gave this talk a month and a half ago, we were telling people, if you're a patient at one of the major medical centers like Michigan Medicine or Beaumont or St. Joe's, that you should make sure you have access to your patient portal, because we're going to tell you, health systems are going to tell you when you are randomly chosen to get your vaccine appointment. And we're going to do that through the portal. And this is still important. If you have older relatives or if you yourself have not signed up for your portal account, health systems will be getting vaccine. They haven't been getting as much as they had been told they might originally, but it is coming. And so being on the patient portal so you get that fast notification and you can right there in the patient portal, that electronic health record access system, make your appointment for your vaccine through your health provider, still extremely important. And we're finding through poll data from U of M's poll of people over 50 that only about 45% of people have logged on to their portal account. So please, this is the time, even when your older relatives and friends are frustrated that they can't quite get an appointment yet, the thing they might need to get that appointment would be that portal account. They also might want to make sure they've logged on to all the different pharmacies, because what we're finding is that the commercial pharmacies, CVS and Meijer and soon Kroger and Costco and others, are going to be getting vaccine as well. And they have their own system. And then we have the public health departments having their systems. And just this week, the clinic that was scheduled for Thursday and Friday of this week for people in Plymouth and Canton which had, I believe, 1,000 appointments available. 1 million phone calls came in. This was only a phone call based scheduling. And that shows how many people were dialing over and over trying to get through. But so there's an incredible demand. And all we can say is, exercise some patience. We know how frustrating it is. And we know that we would love to be vaccinating. At the Michigan Stadium, we could be vaccinating 24,000 people a week. But we right now don't have the vaccine to do it. We are very hopeful, though, that we'll have it. And for folks who are under 65 working in frontline jobs, also a frustrating time because you're feeling like you're going to work every day, you're exposed, and you can't get vaccinated yet. And again, the message here is keep doing the masking, keep protecting yourself, and make sure you have checked your county health department website, or in case of Detroit, the city, and also stores and pharmacy, and signed up for your patient portal. One of those things will eventually work for you. And employers are going to be getting more information and hopefully passing it on to grocery store workers, food service workers, folks like that. People who are under 65 don't work in a frontline job, but have an underlying condition, and that includes obesity, need to also be connecting with their doctor's office. It's probable that you might get it through your health system. And again, that patient portal is important, but also make sure that you're checking those pharmacies, et cetera. But it will be a little while before people in that category are eligible, depending on where you live. So it is an incredibly frustrating moment. I think we saw, we've seen some promises from the drug makers that they're going to be getting more doses out in the millions in the coming weeks, but it does take time to make this vaccine, and then to figure out, how to get it to every jurisdiction, the thousands of counties across the country that are then divvying it up and giving it out. Next slide, please. So folks who are under 65 and healthy and non-obese, then it's also going to be a while. And so this is really important. I think Dr. Summers made this point for both kids and teens and young adults and even middle-aged adults with no conditions. Your role in society right now is to make sure that you protect people around you who are still vulnerable, even if you don't feel all that vulnerable yourself. So that's why the silent spread and understanding the importance of the silent spreader, the person who doesn't get sick, but is infected and can spread the virus, is so important. That is a critical part of this whole puzzle. It has fed a lot of the spread. Dr. Summers, would you agree? And we know that we can prevent a lot of that with masking, good ventilation, not gathering. So that's why you keep seeing all of those rules still staying in place. Next slide, please. And then one thing I'll address before handing it back over, and we see misinformation mouse up there in the corner, is rumors. And I pasted in the chat a link to things they've heard from neighbors, things they media, and where people are saying, oh, it's got these side effects, or it was too rushed, which was something I actually was concerned about myself back in last summer. I was like, is this really going to be safe? Do we know it's going to be put through all the rigor of testing that vaccines normally are? And I've been reassured myself from understanding what the process is, that yes, even though it was much faster than usual, it is still with the safeguards in place that we expect. The other thing that all of us can do as we get vaccinated, so if you've been vaccinated in the last month, you need to think about signing up for the CDC's vSafe system. So this is a system where you can get text messages to your phone from CDC, first every day after your vaccination, then every week after that, and then every day after your second dose, and every week after that for a while, where you're just telling the CDC quickly how you're feeling. Does your arm hurt? Do you have a headache? Did you have a fever? And if you had some of these less common but more intense reactions to the vaccine, they want to know. They also want to know if you didn't have a reaction, because they're gathering and reporting publicly the data on what people are experiencing after vaccination. And that kind of data can help people who are kind of on the fence right now about whether they want to get vaccinated or not. If we can show them, as the CDC has already reported, that out of the millions of people vaccinated so far, only a couple of dozen have suffered an anaphylactic reaction from an allergy to a vaccine component, and that those folks were treated and are doing fine, but that we know now who's at risk, and we're going to take special precautions with people like them in the future when we're vaccinating. So the V-Safe system is wonderful. It's very easy. I've done it myself. People who are pregnant and getting vaccinated, it has a special program for them to monitor them, because we really want to make sure that we understand what happens with women who are pregnant, when they get vaccinated. Next slide. I think we're going back to you, Dr. Summers. Let's see.
Okay.
Yes.
Great. Thanks, Kara. That was great information. And I just want to reiterate everything she said is right on point. So I'm just going to mention briefly vaccine-related scams, particularly if you have a senior in your life that might be more susceptible to these things or to being targeted. Please help them through this, or help, with their understanding. I just put a headline up here. Even in Oakland County just yesterday in the Free Press, there was mention of a scam. So the main thing is to know that you will not be asked for money to get the vaccine. You will not be asked to pay to get early access or to hold a vaccine appointment. And you will not be asked for ahead of time things like insurance numbers or personal social security numbers, personal information from any reputable site. There's even been like a fake Moderna site that was put up, and there have been people arrested for that, where they were collecting $30 from people to sign up to get the vaccine through there with a promise of an early access. So the main point to be aware of is that scams have been reported, especially targeting Medicare beneficiaries. Be aware of phone calls and that sort of thing. And there are mechanisms that you can report. If you have been targeted, you can report this information so we can get the word out there. And if you are, once you are in the position of having your vaccine, if you choose to share a photo on social media, do not include your personal information on the vaccination card, because that's another source of information that people are scraping from online in order to gain access to personal information. Okay, so the new variants, just very briefly, this is a whole nother talk in and of itself. So we have seen the variants that are of concern in Michigan in at least 12 counties. This is a concern, and we are monitoring this. We don't fully understand all of the implications. I think one of the things that we worry about is that these variants are slightly more transmissible. Recent data leads us to think that one of the reasons why the variant that came from the UK might be more transmissible is we think the infectious period might be slightly longer. So it might be that you're infectious for an extra day, perhaps. So again, we're trying to understand the full implications, but the main thing to be aware of is, again, double down on every single one of the strategies that you can participate in, from masking and the high quality masks and social distancing. All of this we know protects against the virus. They haven't changed, these variants have not altered the laws of physics. We still know that masks work and that these other measures that we've been put in place work. We just have to implement them. The vaccines, luckily, can be modified without too much of a stretch. So this would be like a booster shot. And also this is done every year with a flu vaccine, because every year the flu vaccine has a slightly different composition based on the versions of the virus that are in circulation during that year. So this is a strategy that we know how to undertake. It does not require the lengthy clinical trials that a brand new vaccine would. So just to be aware, it's an issue that we'll learn more about and perhaps require booster shots to address. So no matter what, if you are vaccinated, again, preventive steps still need to occur. And I've mentioned this, but just to reiterate, masks, limits on gathering, occupancy, and travel, and just keeping up those virtual connections, as tired as we all are of our loss of interpersonal interactions. We're getting close, and we don't want to blow it on the final stretch here. No matter what, don't delay medical, dental care, emergency cares, and screenings. Get outdoors and stay active and stay connected in safe ways. Prevent spread to keep hospitals from getting overwhelmed and affecting normal care. So we saw in various surges around the country when hospitals get overwhelmed. This is where I mentioned at the beginning that aside from the number of deaths attributed directly to the virus, we do see an excess mortality on top of that. And we feel that to some extent is because of routine care that has been disrupted. And if you can, please lead by example. Be the one who can firmly insist on masks being worn properly and on outdoor gatherings over indoor ones. Spread good information on social media, by email, and in conversation. Again, this is why Kara and I love doing these sorts of community events, is because we want to get as much good information out there and point you to the right resources that you can trust, and counteract misinformation when possible. If you can also, we all understand the dramatic effects that are being endured by communities all over the country. So if you are in a position to give, buy, or volunteer helping those who hurt most, this could include food banks, diaper banks, United Way, arts and cultural organizations, nonprofits, local restaurants and stores, neighbors and friends with high risks and active cases at home or long-term effects, tutoring, patient portal access help, as we mentioned, especially for seniors. Most of the vaccination opportunities, unfortunately, still are online. That event in Canton was one of the few that was phone only. So we really want to help those who need a boost with access. So what does the future hold? Well, we don't entirely know. We hope it does not become endemic, such as the flu. We do think that there is some seasonality going on. So what we'll just have to be prepared to do is get the rates down as low as we can right now in the pandemic. And then we need to adjust our vaccines to fight circulating strains, and then be able to be nimble to, hopefully we'll be at a place next year when we don't have to implement the masking and so forth all over the place. We've seen societies, we know in Asia, New Zealand, other countries, they have been able to get largely back to normal comparatively. So that's what we want to get back to, but also understanding that if we see outbreaks cropping back up, that we'll have to be aggressive in intervening. On the research front, we still need to understand the virus and disease better. Again, it's like an arms race. Every move that we make, the virus makes another move. Variants happen all the time. We've heard about a few in the news that are getting a lot of press because they're ones that seem most concerning, but viruses do this. They create variants all of the time. Some of them are not beneficial for the virus, some of them are, and it's the ones that are beneficial to the virus that persist. We want to better track social impacts and help improve disparities and improve care and recovery. We need to keep our public health system fully funded and be ready for the next emerging disease. I also just want to point out that, we forget in many places in the US, we haven't experienced outbreaks before of a new or uncommon disease, but we do have neighbors, whether it's in US territories experiencing things like Zika and chikungunya, or countries around the globe that experience tropical diseases. These things happen, and the countries in Africa that have experienced tropical disease outbreaks have been better prepared for this pandemic. So we have a lot of lessons that we can learn now to apply to the future. We need to help repair economic damage and strengthen supply chains. And of course, again, address the underlying inequalities that the pandemic has exposed. So I think that's it for what we prepared. We have 15 minutes or so for questions. So feel free to throw things out in the chat, and we'll start addressing those questions.
Great. I've been keeping track of some of the ones that have been coming in, but if you have other questions, please put them in the chat. So we had some, and I think we have the supervisor of Canton Township on with us. Thank you so much for clarifying about the process for that clinic, which, so many people expressed interest in, that they did have an online web form as well. And I will also mention, I'm part of a Facebook group called the Detroit Area Vaccine Hunters. And these are folks who are stepping up to try and help others get vaccinated. And they have a web form that anyone can fill out on behalf of someone who wants to get vaccinated. And then they will pair people up with people who will help them find a vaccine. It's really been incredible to me to watch what these folks are doing. So I put the link to that form in the chat. And if you know someone who really wants to get vaccinated, that's certainly something to think about. If you are willing to help out with getting people vaccinated, I'm also going to put the link to that group in the chat. Join that group and be a helper. So it's a way that people are kind of spontaneously coming together to help people get vaccinated. So some of the questions we've gotten, one actually I think is pretty timely. So once a vaccine's been approved, can't other companies just duplicate it so that we have more available? And I think we actually saw that starting to happen with Pfizer's vaccine, if I'm not mistaken.
So it's true that we can, there's a lot of collaboration around the globe, and these platforms, it started off where everyone's developing things independently, which was good because then we have a lot of shots on goal. And so now it's true that we do have some tried and true mechanisms. The challenge is really, it gets to be manufacturing, having the facilities that are sterile and have the proper technologies, is not insignificant by any means. And even like Pfizer, who developed one of these vaccines, apparently they've been able to really revamp some of their engineering processes to make improvements based on what they've learned, even since they had the vaccine improved. So that ultimately will improve manufacturing capacity. So right now, I would say that I don't think there's a shortage of information technology that is available for vaccines to be produced. It's more of a supply, a resource issue. On the lab end, even things like pipette tips, which are used in the lab for testing, are in a short supply. There's a lot of issues that I think more assertive interventions from the government with things like the Defense Act to help really allocate resources in a more efficient manner will make a dent.
Great. We also had a question from someone trying to understand the 95% efficacy. And I think with the Johnson & Johnson, what we're going to see coming out today and tomorrow is more like a 60 to 70% efficacy. Maybe talk about, in general, most vaccines go for 50% or above efficacy and call it good. So maybe talk about what those numbers mean and where should we sort of, is one vaccine going to be the one you want and one's not the one you want? Or maybe talk about that.
Yeah. Okay. So the first thing I would say is, some people, one of the first world problems is which vaccine do I want? And the one you want is the first one you can get. Absolutely across the board, you want the first one that you have access to. I would take any vaccine available to me. So, because time is more important than the actual number around efficacy. Now, when we look at the percent efficacy, that term is efficacy is what we use in clinical trials, which is a very controlled environment and studying only the participants in the clinical trial. So in the real world setting, we use the term effectiveness, and there's slightly different things. So in a clinical trial, 95% efficacy, first of all, that's phenomenal. Anything like 60-ish% or above is going to be a vaccine that's worthwhile. And in addition, not to get too complicated, but the way we, the endpoints that we use to know if a vaccine works. One of the things with this vaccine is that we're focusing on prevention of clinical disease. So when we get to a point where we've gotten a lot more people vaccinated and reduced the numbers of most medically vulnerable for the clinical side effects, then we might be more concerned with transmission of disease. And a vaccine now that might be said to have 70% effectiveness for clinical symptoms might actually be better at limiting transmission. So all of these things kind of fit into a big puzzle, and it's not really an easy question as to like which one is best, because there's different ways of measuring best, and it might vary based on the time frame we're at. It might be based on the dynamics of the disease and what variants might be available in the population, all kinds of things. So anyway, I could really go into this in a lot of detail, but I just want to first of all make the point: get whatever vaccine you can. We have no reason to believe that any of these are inferior to the point where, they wouldn't be getting approved if we didn't think they were worthwhile, because it'd be worse to have an ineffective vaccine than none, because then you'd have a false sense of security. So anything that's passing the rigorous regulations that we have in the US is going to be a beneficial vaccine.
Right. We also had a question about folks who have had COVID and their chance of reinfection versus folks who get vaccinated and their chance of getting infected. So I guess people are being recommended to get at least one dose, and really two if they've had COVID in the past, because there's still that chance of reinfection once your defenses have waned, correct? So,
yes. Yeah, just to add to that, the issue with natural infection, if you've had the infection, we don't know how long that lasts, but beyond about 3 months, we're not so sure that you have great protection. However, in people who have an infection, the first dose of vaccine for the 2-dose ones that we have on the market might be enough to really get you to a place of the level of immunity that someone who had never been infected might need 2 vaccines for. So the long and the short of it is, if you want a durable response, that lasts into the future, you definitely want to get vaccinated, even if you've had the virus previously. It's going to prime your immune system a little bit, having had the infection. So it probably gives you some protection. We don't know how long that lasts, and it's certainly not as good protection as the vaccines are going to offer.
Great. Somebody asked about taking something ahead of getting your vaccine to stop the side effects, and everything I've seen says don't try and take painkillers ahead of time because you're actually going to dampen your immune system's ability to respond to the vaccine by taking a Tylenol. However, in general, and you'll get an information sheet when you do get vaccinated that tells you how to manage symptoms afterward, and that can include painkillers. Specifically, I believe acetaminophen or Tylenol is being recommended. But the idea is that those do change your immune response. So I think I have also heard some people say hydration, drink a lot of water before you get vaccinated, can't hurt, right?
I'll just underscore that. In addition to the painkiller issue, what Kara was alluding to is, the response that your body is having to the vaccine. These are like chemicals in your body that are helping your immune system. And when you take something like Tylenol, it's reducing those in your body. So we think it might counteract the vaccine a little bit. However, so that's why I wouldn't routinely say take it before the vaccine. You might not get a reaction. If you really do need to manage a symptom afterwards, follow the guidance on the vaccine sheet or talk to your healthcare provider, but I wouldn't make that your first line of action.
Right. We have one question about, and you talked about with a mask, using a paper bag between uses, and somebody talking about how often can you, or how much can you use that paper bag. So we also need to mention washing cloth masks. After you've been out to the grocery store, that cloth mask should go in the laundry or the hand wash and not be used again until you've washed it, right? But for a paper mask, like an KN95, you can put it in that bag and then pull it out maybe for another day or two, or what's your recommendation?
Yeah, I think that it really depends on your wearer. If my personal feeling is if you're wearing a mask all day long, like in a school setting, I wouldn't reuse that mask unless that's your only option. It's more like if you're going in and out of stores, just use your discretion. The more times you handle it, the more, ability there is to for it to degrade or for it to be spreading virus around. So if you're just going into a few different stores, maybe pop it in the bag a few times, but I wouldn't make this if you're in a position to change it every day, change the bag and the mask every day, just buy a bunch of the paper lunch bags and have those on hand.
We had a question about what might happen by the end of March if these new variants really do start spreading faster than the old variants, and whether we're going to see another surge and more lockdowns or hospitals getting overwhelmed. What's your crystal ball on that?
So, anything's a possibility at this point. I have heard some modelers believe there will be another surge. It's an arms race. I think there's so many variables in this. One of them is how quickly we can get vaccinations to occur. And, some of it's random. Where have people traveled where one of these variants gets introduced into the population? And most importantly, can we stomp it out if we detect the variant? If we have enough surveillance to detect the variant, then we can go more aggressively with things like localized lockdowns for a short period of time. That's like what happened with the U of M athletics department, is they had to be very aggressive in order to prevent that from spreading beyond. So I think if I were having to guess, I would say there's probably a propensity for more localized outbreaks, but hopefully not across the board like we've been seeing uniformly across the United States. So the standard recommendations again apply and will help us stay out of that position.
Right. They're not smaller. They can't get through holes in masks to the old virus faster, right? It's not.
Absolutely.
Now that appears to be effective against variants.
I will just say on that point too, that especially if you're in an area where the variants have been detected, but in general anyway, the activities right now that in most places are allowed but pose the highest risk are things like indoor dining, gyms, coffee shops. So just be aware, just because things are allowable does not mean it's safe. And my own personal feeling was when it comes to restaurants, absolutely support your local restaurants, but I still would definitely prefer takeout over going to an indoor dining scenario at this point in time when it's still winter and we don't have windows open and things like that. So these are things, there is still some personal discretion but those are the sources right now that are least controlled and pose the greatest risk.
We have a question that was about the Schoolcraft College vaccinations that were offered to employees as part of the Wayne County clinics on the site, and someone feeling like, but I have an elderly parent, I feel guilty that they couldn't get vaccinated along with me. And this, I think, there's a broader issue here of people who get vaccinated, who know someone who's at risk and can't get vaccinated because the supply is so low, and that kind of guilt that might be felt. And I think this idea, though, that every vaccination counts toward reducing spread, we think, and every vaccination counts toward reducing burden on our healthcare system. But so I guess maybe Dr. Summers, can you address this feeling people might be having after they've been vaccinated?
Yeah, I know, I totally agree. It's a very fair comment. And even more broadly, in the US, we're in a better position than many other countries. So equity is something that we have to struggle and grapple with. I still say that no matter what, if you have access, get the vaccine, because you will have some degree of protection for the people around you. It's a societal, it's a duty of being a citizen, in my mind, getting your vaccine. And even though you personally might prefer to give it to somebody else, like through my workplace, I was eligible and able to get a vaccine prior to my elderly parents, and I would have done anything to give it to them. But you have to do it when you can. The worst case scenario is if vaccine doses go unused, if there's some sort of an issue where a clinic doesn't have someone that's air quote eligible and is unable to get it into an arm of somebody. So yes, I've seen bioethicists talk about this. Even a well-known epidemiologist who's HIV positive has talked about this, and even the bioethicists say get the vaccine.
And then lastly, and this gets onto equity issues for sure, is the systems that are being used by healthcare systems, public health departments, and pharmacies to give people access to sign up and or to register, to be notified when they can be signing up. And a lot of them don't have the waiting list for the person who's next in line. It's just who's currently eligible who can sign up. And so this idea that a lot of these systems have been created pretty quickly or haven't been mass tested, and now they are being mass tested. And so I think that over time, you'll see people make improvements to their computer systems and say, okay, you're not eligible yet. We will hold your name and let you know when you are. And I think that's what's going to happen. But I think that what we're seeing is such tremendous variation based on the fact that this vaccine is being offered in so many places and through so many systems that we're basically had to ramp up since November, knowing that vaccines might be coming in time for January. And it's a massive technical challenge, but people are trying to rise to that. So we also had a question from someone who's in Florida, hoping they can get it in Michigan by April. And I think it's safe to say, from what we've been hearing about supply and now a third vaccine probably coming online, that supply by April will be much, much better than it is right now in late February. Are there any other questions? We're just at time, but we really appreciate the opportunity. Chris, thank you for the invitation. Dr. Summers, thank you for speaking. And do you have any final words for everyone?
No, I mean, and thank you, Kara. So again, we're happy to field questions via email afterwards if something comes to mind. Anything that you've learned that you can use to promote, good behaviors or vaccine information, or getting the right information into the hands of those who have uncertainty, absolutely, that would be wonderful. And that's one of the hopes that we have for these sessions.
And I'll make sure that we have the slides and the list of links available along with the video through the Schoolcraft Foundation website. So thanks again.
Thank you, everyone. Dr. Summers, Ms. Gavin, this was wonderful. As you said, we will have a copy of the recording and the slides available on the Schoolcraft College Foundation website. If anyone has a question that they weren't able to post, send it to us and we'll make sure that it gets over to Dr. Summers and Ms. Gavin. We'll get an answer back to you as soon as possible. Thank you again, everyone, for joining us on this conversation. Our next conversation is going to be on March 25th, where we're hosting the Michigan Civility Project. That's Nolan Finley and Stephen Henderson, two well-known journalists who are going to show us all how to remember how to behave in public. So thank you again to our wonderful guests. Thank you all for joining us. Stay safe and let's all stay healthy. Have a good day.
Thank you.